Hi guys, I'm Dr. Meghan Barry.
And I'm Dr. Rachel Boccard. We are here at Onondaga Physical Therapy to give you a little bit of information about your QL or Quadratus Lumborum muscle. We're going to be going over the anatomy, the function, and some ways that you can stretch it. So I'll show you on Meghan. The QL muscle attaches along the posterior iliac crest, which is your hip bone here, goes up and inserts into your 12th rib and the transverse processes of L1 through L5, so your lumbar spine.
So a lot of people don't even know that this muscle exists, but it is one that is commonly irritated with people who have back pain. So like Rachel said, we're going to show you a couple different ways to stretch it and to release it on your own.
I'm going to perform a QL release on Meghan. So what I want her to do, Meghan, bring your knees up towards your chest. So I like to get them into this position because one, it's more comfortable, and two, it allows a little more space to open up between the 12th rib and that iliac crest. So on females, you have a little more to work with compared to males where that space is going to be a little harder to access. So in this position, I usually start with my thumb, but if you prefer, you can use your fingers as well. I'm going to palpate the 12th rib. Once I'm there, I'm dropping down so that now I'm on the side of her trunk on muscle, and I'm applying a straight downward pressure into the table. Is that tender?
Yes.
Okay. So I'm going to hold this sustained pressure, and what I like to have my patients do is some deep breathing by focusing on breathing into the lateral or the outside part of their ribs. So because the QL attaches to that 12th rib like we talked about, this creates more of an active release and allows the muscle to lengthen and stretch and helps to release it a little more.
So now I'm going to show you how to release the QL by yourself. All you'll need for this exercise is a tennis ball and a chair. So you're going to put your feet up on the chair, and then you're going to put the tennis ball right on the side of your trunk, right where that QL lies. And you're going to lay down, putting a lot of pressure through that ball. And next you're going to take your knee, bring it up towards your chest, hold it for a second, and then come on back down. You're going to do this about 10 times, and you should really feel a good stretch in there. So once you've done your 10 bringing to the chest, you're going to take that knee and drop it out to the side. It just hits another part of that QL that sometimes gets neglected. So you're going to let that knee fall out 10 times as well. You should feel it hit that muscle.